We haven't done an update in a long time, but there hasn't really been anything like medically going on, so to speak,
No.
or anything. So we've just been kind of like in a static place, and it's been good.
Yeah.
And
out doing stuff. Too busy to be on the line making videos.
yeah, we've been out a lot more, going fishing a lot. I'm sure, like most people have seen, we've been going like fishing a lot and just having a lot of fun, being outside and getting fresh air and enjoying the sunshine and just like enjoying life.
Yeah.
We really like didn't feel before like we got a break in between
Radiation.
yeah, radiation, and then getting sick again. And it just, everything before just happened really fast. We thought before we were gonna have like a break and life was gonna like settle down and we were gonna have some time
Like a couple of years or so
before things got hard again, and it just didn't work out that way. But I mean, it ended up being like an incredible blessing, because
yeah,
that's how I ended up on this immunotherapy, and it seems to be going well. We'll have a CT scan in about 2 weeks on the 9th of next month, and then I should get the results like the very next day. I have a doctor's appointment after that, so that should be good. And
yeah, so some of it is just trying to get out and get exercise and do it in a way
organic way.
Yeah, where we're having fun and like building your energy up without overexerting you too much, which has happened a little bit. But
yeah, at first, even the first few times, or like the first week when we were going out fishing, I mean, we're not going out on some like giant expedition.
just
like
going
to the park and like
and
standing up and like yeah, it was exhausting. It like wiped me out. So my energy has been like growing and growing, where I'm getting like better and better, and then I'm having like really weird like mixed feelings, like with the fentanyl patch. I came all the way down to 37.5, and then I still felt like I was on like a little bit too much. And because like when we're out fishing and stuff, if I sit down on the ground, when I stand up, I feel like short of breath. I have a hard time like catching my breath. My heart pounds. I feel like a little bit dizzy. And those are all like signs to me that I'm on like too high of a dose of medication. But I never feel like whoa, like I'm on like medication. So it's really weird. And in addition to that, so like last time when I finished the chemotherapy and the radiation, I started having, well, even while I was having radiation, I was having this terrible pain in my arms, and where
shoulders and joints.
Callie was having to dress me and stuff, and so that's happening again. Whatever the chemotherapy and radiation did to my body, the doctors don't seem to understand, or like they've never heard of it before. But like, I took a shower last night, really hot water was hitting me, and it literally was like some of my veins had like exploded from the hot water hitting me. Like today I felt like somebody kicked me in the shin for like absolutely no reason, just like hurt, like got kicked in the shin. My legs are covered in like not just like varicose veins, but like exploded like blood vessels and stuff. So it's definitely like ravaged like my body. So I have a lot of like weird pains. All of my joints and stuff ache, and I'm really like fidgety and stuff because I have like just lingering pain. It feels kind of like the flu, like that kind of achy pain. This isn't agonizing pain. It's not like before. The nerve block, praise God. Like, thank you, Lord. It has worked well, and the pain hasn't come back. So yeah, I have this like lingering other weird body pain. Now that I've come down so far off the fentanyl, I'm starting to be able to feel like the aches and pains in my body again. Before, the fentanyl was pretty much like overriding it. I wasn't feeling anything except for this like agonizing like nerve pain in my stomach. So yesterday I had treatment. I tried to explain this to them, and where these like aches and pains, I'm sometimes having to take breakthrough medications again, which means taking like a pain pill.
Not like before though. Like you're taking one instead of.
Yeah, taking like one for the whole day, or maybe on a really hard day, like two. And I have two different pain pills. I have like strong. I have like category 1 strong, and then I have category 2 strong, and then I have the fentanyl patch, right? The fentanyl patch is constant. And anyway, so sometimes I'll have to take the category 2 strong, like at night. And then if it's daytime, I take like the category 1 strong, right? So, and I'm not taking them every day. I'm not taking them all throughout the day. I'm not taking multiple different kinds in a day. This is completely different from any pain before. So yesterday I had treatment. I tried to explain that to them, and the doctors have been like all over the board, like about like what we should do. One of the doctors I see, the one I saw last week, when I tried to talk to her about the pain, she was like, I'd rather have you on more fentanyl than have you on any breakthrough pills. And I already feel like I'm having like difficulty like breathing sometimes from the fentanyl and stuff, so it doesn't, and if it doesn't stop pain but one pain pill on top of the fentanyl does, like it doesn't make sense to me to take more fentanyl. But whatever, it doesn't matter because she didn't prescribe more fentanyl. Anyway, so then yesterday I saw my regular like oncologist, and she
wants you to stay on the fentanyl.
She wants me to stay on the fentanyl, and she also thought maybe it should increase and be increased back to 50. And she didn't have a problem with me taking the breakthrough medications at all. She really seems to like understand that it's necessary and that it's like we're dealing with cancer, so it's like, you know, it's really necessary. So today I went to the pain doctor, and I'm still like really emotional about it. And I never wanted to get like involved with pain doctor anyway, and I've explained that ad nauseum. So I go to the pain doctor today, and the first thing is like having to fill out this drug addict questionnaire about like how many people are telling me that I have a drug problem in my life, like
how many times you go to NA,
how many times I've been to NA, how many times I've been AA, rehab, you know, like, has your family done an intervention? It didn't ask that, but it was just a bunch of silly questions. Am I like in legal trouble or going to jail? And like, it was really like, it's humiliating. It's just stupid. It's like a page and a half of ignorant questions.
I mean, they make sense for like a pain doctor to have to give because he's being scrutinized by the DEA. I get it.
I do get it. I feel like there's like a certain category of patients, you know, maybe if you have like a physical deformity or you've had an injury that's like absolutely non-recoverable, or you have cancer, or
you're on hospice.
Or right, like a bunch of things that should like, you know, negate this form. And it's just humiliating. It's stupid. And so then we go into the doctor, and I have to take a drug test like right away. It's the first time I've been drug tested since I've had cancer. And that pretty much was like the icing on the cake for me. Then we had to wait for like an hour for the results of the drug test. A little over an hour, the doctor comes into the office, and I like explain the pain to him. He's perfectly nice. He's not like a mean doctor or anything. And where like this dealt with pain that he could do a procedure and deal with for the nerve block, absolutely wonderful. For this like cancer, like body aches and pain that is like mysterious, he was like, he was very
Also wants to keep you on the fentanyl.
he was very indifferent. He wanted to keep me on he did want to keep me on the fentanyl. He didn't want to increase it. So he rewrote a prescription for the 37.5 microgram fentanyl patch, and he said that he was asking about the pain, and I told him I have to take breakthrough medications, and explained like, you know, like how often I may have had to take them and stuff. And so he said he would rather I had one, which was the lower category of strong one, than the other. And so
Well, he let you pick which one.
No, he said he would rather me not have the Dilaudid. He said he would rather me not have that. And I was like, let me explain. I'm not taking them like together or throughout the day. I'm taking that at night. And you were like, it helps her like sleep longer, like through not being woke up. And he was like, no, I'd rather you not have that one. So he rewrote a prescription for the hydrocodone, and then he wrote a prescription for the fentanyl. But overall, the whole experience like really upset me, and so I decided today that I'm not going to subject myself to this. I've already explained multiple times into multiple different people at the cancer center, different nurses and different doctors, that like I don't want to deal with pain management. And today just like sealed the deal. Like I don't want to deal with pain management. It's humiliating, and it's like it makes you feel like it's like you've done something shameful. Like, so I just can't. And like mentally, like I can't do it. I can't continue to subject myself to this, and I'm not going to. So I decided today I'm just going to come off of like all the pain medications. I'm going to come off the fentanyl today, and I'm just going to use like what other breakthrough medications I have to like be able to taper down. Now, last time I came off of all the pain medications, it's exactly how I did it. And the doctor then, I was on a higher dose of fentanyl, and he was just like, you need to come off the medications. It's time.
No, this was with the radiation one, not the most recent.
Right. This was, this was back before I even started immunotherapy. And I just did. I just came off of them. And it wasn't a big deal. And I didn't get sick or anything. So I'm just going to do that again. So I need prayers to just like make it through that, and for my pain to stay like
manageable,
tolerable. And you know, it just is what it is. So that's it. And then
but you have a new schedule now that you moved into the new phase of your immunotherapy. You only have to go 2 days a month.
Yeah, I don't have to go every week, which I wasn't even aware that was going to change, but that's our new thing. I only have to go every 2 weeks. And part of like with the pain management, like part of like what is an added frustration about that is like it's already like we drive a truck, a V8, like 3 hours to San Antonio. We have to stay an extra day to go to see both of those doctors. And I have to see that doctor every month. It's like an added
doctor fee.
Added expense. He can't use the cancer center pharmacy, can only use like a regular pharmacy, and our prescriptions from him are more expensive. So like everything costs more. It's way more time. Although it's a blessing to us, like, to get to be here. It's not like, oh, it's a horrible thing and we've been in a hotel and it's like
right.
sad or anything. We're like having a wonderful time. We're with like one of our dearest friends, and we're having Bible study and dinner, and like it's beautiful and wonderful. It's just the point, like it's like making you jump through like a bunch of hoops that are like unnecessary. So there's just like a bunch of little added things to it that are just like, it's just too much. Like, it's just too much. So
now it's every other Wednesday that we have to come back.
yeah. And so, yeah, we're just gonna cut out since my oncologist won't do it for me, I'm just gonna like cut pain management out myself by getting off of pain medication, and then I'll call and let him know before my next appointment, like, do you need to see me, or
I'll let you know when I'm
off
ready
of-
for the next nerve block.
yeah, I don't want him to fire me as a patient. I definitely would like in the future to be able to have a nerve block from him if it's necessary. So I don't want to upset him or anything. I just don't want to be on this pain management like circus thing. You know, I just don't want to do it. It's too much for me. So that's
Okay.
it.
Yep.
Hopefully we'll have like a really great update about the cancer
2 weeks.
in 2 weeks. Everything otherwise, like with the cancer, like has been just like feeling great. Like the cancer pain is gone, and we're just very like hopeful and prayerful that and believing that the cancer could actually be gone. So we're very excited about our next CAT scan. So it'll be good. All right, thank you. That's it.